Good day, everyone. We are the group 4 and we are going to talk about schizophrenia. So, what is schizophrenia? Schizophrenia is a chronic, severe mental disorder that affects the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. Though schizophrenia isn't as common as the major mental illnesses, it can be the most chronic and disabling. What is the cause of schizophrenia? The exact cause of schizophrenia are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop the condition. Some people may be prone to schizophrenia, and a stressful or emotional life event might trigger a psychotic episode. Hi, I am Ms. Tolosa and I'm going to discuss the signs and symptoms of schizophrenia. So the signs and symptoms of schizophrenia. We have three types: positive, cognitive, and negative. First, we have positive symptoms. These are delusions. This is a false beliefs that are not based in reality. We have hallucinations involving seeing or hearing things that don't exist. Disorganized speech, thinking, and catatonia, which is purposeless abnormal motor activity or aggressive behavior. We have the next type, cognitive symptom. This is having a poor executive functioning. It is an inability to understand information to make decision. We have poor working memory. It is inability to use information immediately after learning. Next type, we have the negative symptoms. Flat affect. This is reduces expression of emotion via facial expression or voice tone. Next, we have alogia. It is a reduced speech, avolition, inability to begin and sustain activities. Anhedonia. It is inability to experience pleasure. Asociality is a withdrawal from a social interaction. And lastly, we have reluctance to perform everyday tasks.
Good day, I am Maxime Nicole Paris de Barada, and I will be taking you along with me as we discuss the types of schizophrenia. Schizophrenia may look different from one person to the next, but there are 5 main categories into which the patients fall. First up, we have the paranoid schizophrenia. So this is the most common form and usually characterized by positive schizophrenia symptoms like delusion and hallucinations. So the person's paranoia may be extreme and they may act on it. We may relate it to the statements such as when the person comes out your door and he or she says, "Why are you following me?" So they may also behave oddly, have inappropriate emotional responses, and show little pleasure in life. The next is the catatonic schizophrenia. This is a rare type and can be its own disorder, but it often has negative symptoms and are not very responsive. The person may shut down emotionally, mentally, and physically. He or she may not react to the stimuli, stay in strange body positions, make odd movements, or have rigid limbs that will stay in the position they are moved to. Moreover, they may show no facial expression and stand still for long periods of time. There is also no drive to eat, drink, or urinate. When catatonic schizophrenia lasts for hours, it becomes a medical emergency. Moving on to the third type, we have hebephrenic, or what we term as disorganized schizophrenia, because these people usually have disorganized speech and behavior. They may also have inappropriate emotional responses or lack of any emotional response. For residual schizophrenia, it is used when people have a past history of positive schizophrenia symptoms but now only have lingering negative symptoms or none at all. These lingering symptoms may include poor attention, some mental disorganization, and emotional withdrawal. The fifth and the last type of schizophrenia is the undifferentiated schizophrenia. This classification is given to people who may not fit into any of the other classification. So the person has various vague symptoms. They may not talk or express themselves as much. They can be confused and paranoid. The person may not bother to change clothes or take a shower. So they exhibit both positive and negative symptoms.
For the management, we have Ruste, Perandos, Maglaseng, and Logroño.
For the nursing management, We have assess positive symptoms, assess for command hallucination, and explore answers. Also, assess if the client has a fragmented, poorly organized, well organized, systematized, or extensive system of beliefs that are not supported by reality. Assess also for the pervasive suspiciousness about everyone and their actions. Next, promote social skills, provide support in assisting him to learn social skills. We also have ensure safety, maintain a safe environment with minimal stimulation. Next is deal with hallucinations by presenting reality. Explore the content of hallucinations, avoid arguing about the hallucinations, and tell them that you do not see, hear, smell, or feel it, but explain that you know that these hallucinations are real to him. Next is encourage family involvement. Involve the family in patient treatment and teach members to recognize impending relapse. Suggest ways on how families can manage symptoms. And lastly, promote compliance and monitor drug therapy. Administer prescribed drugs and encourage the client to comply. Ensure that the patient is really taking the drug. Observe for manifestations that warrant hypersensitivity reactions and toxicity.
For the medical management, we have individual therapy, social skill training, family therapy, cognitive behavior therapy, lifestyle and dietary modification, and lastly, electroconvulsive therapy. First, we have the individual therapy. Psychotherapy may help to normalize thought patterns. Also, learning to cope with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. Next, we have the social skills training. This focuses on improving communication and social interactions and improving the ability to participate in daily activities. Family therapy. This provides support and education to families dealing with schizophrenia. Cognitive behavioral therapy. It is a collaborative, time-limited in nature, and provides clients with the rationale and methods necessary to develop self-management skills. We have the lifestyle and dietary modification. All the patients are to be advised for a change in lifestyle and diet to reduce the risk of metabolic side effects and cardiovascular morbidity and mortality. This includes physical exercises, dietary modification, and abstinence from smoking. Lastly, we have the ECT or electroconvulsive therapy. For adults with schizophrenia who do not respond to drug therapy, ECT may be considered. ECT is a helpful medical treatment for someone who also has depression.
Good day, everyone. This is Jera Alteriz Maglasang, and I'm going to discuss the pharmacological management of schizophrenia. So, the common medications indicated for this condition are antipsychotic medications. These are typically used to treat symptoms such as delusions and hallucinations that people with the condition may experience. This type of medication can be taken orally as a daily pill or liquid form or given at less frequent intervals as a shot or injection. So, antipsychotic medications block the dopamine receptor D2, which reduces dopamine levels in neurons. This suggests that maybe schizophrenia has something to do with the increased levels of dopamine. So, these medications, though, are neither universally nor completely effective and don't work for everyone with schizophrenia, which adds to the confusion and means there's probably more to it than D2 receptors. And one of the effective antipsychotic drugs is the clozapine. It is a second-generation atypical drug. So when we say a second-generation antipsychotics are in general more efficacious or effective than first-generation antipsychotics. So clozapine is also a weak D2 antagonist, suggesting that other neurotransmitter systems like norepinephrine, serotonin, and GABA are involved. Common side effects which no need to report in this medication are weight gain, hypersalivation or basically drooling, and sedation. So, in weight gain, we need to teach the older adults about managing their weight. And also for sedation, we need to inform the elderly to prevent engaging activities that puts them at risk for injury such as driving. Adverse effects of this medication is first we have the granular cytosis or basically low white blood cells and low immunity aka leukopenia and decreased neutrophils. So we need to put in mind that the older adults will increase the risk for infection while taking this medication. So we need to inform them to comply with regular blood monitoring and teach measures to prevent infection.
Good day, everyone. This is Ms. Logroño, and I'm going to report the surgical management for schizophrenia. The surgical management for schizophrenia is the brain stimulation. This is a surgical procedure involving the implantation of a thin, flexible wire called a lead. It's a new treatment that uses electrical pulses to help parts of your brain to communicate better. When you get a deep brain stimulation, a surgeon places wires and electrodes in your brain, and they are connected to another device that they put under the skin in your chest to control the electric signals. And you will undergo two surgeries for this. One to place the electrodes and the other to put in the device that controls them. First, in the operating room, your doctors puts your head in a frame to keep it still. Then you will get an MRI, a machine that uses powerful magnets and radio waves to make a detailed picture of your brain, and it gives your doctor a map to show them where to place the electrodes. And your surgeon will drill a small hole in your skull and put in a thin wire with electrodes at the end into the specific area of the brain, and you will get medicine so you won't feel any pain while this is going on. The second surgery to put in the control device may happen the same day or the following day. You'll get a general anesthesia, which means you won't be awake or feel any pain during the procedure. And your surgeon places the device under your skin near on your collarbone, and it will be connected under your skin with a wire from the electrodes. And the risk for the brain stimulation, bleeding in the brain, stroke, infection, breathing problems, heart problems, and seizures. Side effects, numbness or tingling, muscle tightness in your face, speech or balance problems, depression or other mood changes, and lightheadedness.
Nursing assessment, we have here physiologic deficit, objective cues, difficulty of establishing verbal communication, inability to discern usual or normal communication patterns, thought blocks, hallucinations, delusions, and poverty of speech. For the subjective cues, patient states, I do not know. Diagnosis: impaired verbal communication as evidenced by difficulty of establishing verbal communication, inability to discern usual or normal communication patterns, thought blocks, hallucinations or delusions, and poverty of speech related to altered perceptions due to biochemical alterations in the brain secondary to schizophrenia.
Hi, I'm Denzel K. Essa, and I'll be continuing on. So based off that diagnosis, we have the scientific basis for that is that schizophrenia is a mental disorder that targets the brain's forebrain, hindbrain, and limbic system. The limbic system is responsible for controlling moods and emotions. Therefore, individuals with schizophrenia have trouble telling what is real and not real, thinking clearly, conveying normal emotional responses, and acting normal in social situations, which is why that verbal communication is impaired because of that impairment to the limbic system, causing those different responses than a normal person would have. For the objectives of care, we have the general objectives. So after 1 week of nurse-client interaction, the client will be able to establish reality-based thought processes and effective verbal communication. Specific objectives: after 8 hours of nurse to client interaction, the client will be able to 1. Demonstrate reality-based thought processes in verbal communication as evidenced by realistic statements. 2. Attain proper social skills as evidenced by interacting with 1 or 2 other people in structured activity neural topics. And 3. Show effective awareness and communication as evidenced by having 2 to 3 minute, 5-minute sessions with the nurse sharing observations in the environment. Here we have the nursing actions with the rationale. First, we have the independent, so assess and monitor the patient's Coherence of speech and cognitive ability. This is to help establish baseline as well as short-term and long-term goals to create an environment that is calm, quiet, well-lit, and conducive to effective communication. So having an environment that is free from disturbing stimuli helps in preventing confusion or hallucination in a patient with schizophrenia. 3. Speak slowly, keep voice in a low volume, and use clear and simple words when communicating. Loud or high-pitched noises may trigger anxiety, agitation, or confusion in a patient with schizophrenia. So the use of simple words and clearly speaking can help the patient understand what is being said. 4 is educate the patients on ways to improve verbal communication, such as focusing on important activities of daily living and meaningful tasks, and replace irrational thoughts with rational thoughts. This is to gradually help the patient achieve effective cognitive thinking and functional speech. 5. Use simple, concrete, and literal explanations. This minimizes misunderstanding or incorporating those misunderstandings into delusional systems.
Hi, I am Chasa National Basin and I will be talking about evaluation. First, patient is able to communicate in a way that others can understand. Patient demonstrates reality-based thought processes in verbal communication. And lastly, patient is able to effectively interact with others.